Hi, everybody. Today we're going to be talking about sexual performance and function. I'm Dr. Yousuf Siddiqui. I'm a naturopathic doctor at Nutrichem. And today I have Drew Klein joining me. Drew is the president of FocusWave Clinic here in Ottawa. And his clinic helps men with erectile dysfunction, Peyronie's, and chronic pelvic pain syndrome. So those who, well, first of all, welcome, Drew.
Having me. Thank you.
No problem. So those who are patients of mine, those who follow me on social media, know that I'm a big advocate for men's health. And I treat men for an array of issues from digestive complaints to sexual dysfunction, prostate-related issues, which is affecting younger and a younger segment of men right now. Anxiety, insomnia. And what sets me apart from a lot of other naturopaths and practitioners for that matter is that, I have tools, assessments, and I use a language that men can relate to a bit more, which helps me with understanding, gaining actually a better understanding of the root cause of what's going on. So when we talk about erectile dysfunction, which is what we're going to be talking about today, or also known as ED, one of the key things that I work with my patients to create an understanding is getting to the root cause of what brought them into my practice in the first place. Now, erectile dysfunction, Drew, we can talk about this. We've talked about this. There's a subjective element because, your sexual performance is subjective. It's how you feel within that relationship with yourself and then your partner as well.
Mm-hmm.
Right?
That's right. So yeah, I think a lot of the questions that maybe you see and that we have already seen in our early stages is my ED psychological? Is it in my head or is it a vascular issue? And from our experience, it tends to be very vascular, but I think that you might have seen many more cases of non-vascular type ED. Is that correct?
Yeah, and so I mean, this is a great point. The root cause of erectile dysfunction is vast. So it could be psychogenic. So, I actually just posted on my Instagram account, which I'm horrible at Instagram, but about anxiety and how anxiety manifests itself in men. And the word anxiety, a lot of guys won't actually relate to, but they'll relate to like agitation and anger and quick to go from 0 to 10. Yeah. That's more of like an anxiety picture with men, and that plays like a huge role in how a man like identifies with his sexual self, right? Performance anxiety, a lot of guys will know about that.
And the vast majority of people who come into our clinic, I mean, they're all self-identifying. They're also, self-reporting their condition. So, they may be a little hard on themselves, or they might be a little bit boastful. So it's not maybe the most accurate description of performance, but what can be, quite easily decoded is how severe a man's ED is based on the vasculogenic properties of an ultrasound or, their overall health. And, look, it's November, it's Men's Health Month. That's why we're here to talk about this. So I think, for me, it's very important for, and I should probably identify what my company does and we help people, but and I will, but it's really important that we take men and we put them aside and we tell us what we need to do to get better, to get healthier. And part of what we do is getting over that sexual health condition disorder and moving past it, and ideally getting through it, because it can be just so devastating to men to not be able to perform. And I see it, you see it, and I want to help.
No, and and this is why we're doing this video, because Drew and I, our philosophy regarding men's health. I mean, men's health is really broad. And in my opinion, erectile dysfunction is a symptom of some underlying condition. And we're going to talk about that Actually, I'll just give you a few examples. So we talked about the anxiety, the psychogenic side of it. Anxiety can play into insomnia, which will then decrease testosterone, alcohol, tobacco use. Guys who have lower motivation or mild depression are going to have, may experience some sexual difficulty. There's endocrine imbalances like diabetes, obesity plays a role. Testosterone, men and their testosterone. I don't know if you hear a lot of guys are really concerned about their testosterone levels. It does play a huge role in health as well. But when we're talking about erectile dysfunction, we can, as you mentioned earlier, forget about the cardiovascular component. So these are men that are coming into my practice, for example, who have some sort of an underlying cardiovascular related issue. And the way that I help them is by managing their hypertension, managing their diabetes, helping them lose weight, managing their cholesterol, and then also at the same time working on their testosterone levels, cleaning up their system, optimizing what has caused them to develop erectile dysfunction. But I do have a subset of patients that as we're working through that, we're building their vitality, their energy, their confidence. But sometimes there's a segment of the population where even as we're transforming their body, ED still continues to play a role. And so this actually, I'm always researching different ways to help my patients. So this is how I met Drew, because I'm like, well, there's this kind of, in my medicine, I need a modality to tap into that's going to help with that vascular component that's going to help these guys. So let's talk about focused shockwave therapy, which is a modality that your clinic offers men in Ottawa. And can you tell us a little bit about that? Tell me about that.
So focused shockwave therapy, which differs from radial shockwave therapy or acoustic wave therapy, is a modality that has been shown to extremely promising results to treat ED. And basically what it does is it triggers cell-specific responses in the body that can promote the healing that is required. So our system is the industry standard product in shockwave therapy. It's made by the pioneers of the modality, and basically it's low intensity to mid intensity frequency electromagnetic shock waves that are blasted into your body painlessly, mind you.
That's an important thing to mention, right?
Very important thing to mention. And it's been shown to promote angiogenesis, new blood vessel generation, improved blood flow. It clears vessel blockages in many cases, and for certain chronic pain conditions, it can promote decalcification in certain tendinopathies, and it also can release growth factors. And there's some studies that show that it even can promote stem cell formation, which is, potential to really amplify the restorative process. So the focused shockwave modality is relatively young. It's not a tried and true solution, but the results are unbelievable according to the studies that we've read and that we're seeing. So I think that a solution like ours, which is, like I said before, painless, there's no side effects, it's very safe, and when in combination with your treatments and your philosophy and your supplements, I think when you combine them together, you have the potential to substantially reduce the prevalence of this problem for men, especially men over 50 who tend to be the ones who suffer most with this problem.
But are you not seeing that there's like an increase in the number of men in their 20s, 30s, 40s who are experiencing some level of ED? It could be partial, it could be full, but the prevalence seems to be, before it was always men, andropause, in men in their 60s, but now it's men that are much, much, much younger than I'm seeing in my practice.
Shocking for me. I mean, since we're a new clinic, we only started October 1st, and we are the only actual dedicated shockwave therapy clinic in the city. I was shocked to see the younger men coming in. I've never experienced ED. I don't know exactly how these men are feeling. I sympathize and I want to help. I really do. But I think what it tells us, and especially as I'm sure you've seen, is that ED is usually a harbinger of things to come. It's usually not good things. It might be a sign of diabetes. It might be a sign of some heart condition that's about to start. And I'll give you a personal example. When I was 36, I had a TIA, a transient ischemic attack.
Right.
And it was a warning sign to me that I need to lose weight. I need to get healthier. I need to stop smoking. I need to do all these good things for myself. ED in many cases is a similar type of warning sign. And you know, I've become very interested in what they call the gender health paradox. I'm sure you see it a lot every day, and it's probably part of what maybe drives you towards focusing on men.
Right.
We die earlier in every single age group. Our life expectancy on a global basis is like 6 or 7 years less than women.
Right.
You know, women maybe get sicker according to some of the studies I've read, but men die quicker. And there's a way for us to do better at this. And I think that, you know, understanding that you have some warning signals out there that can tell you that you need to change your lifestyle and going forward with those changes is really important. So, you know, I found that I find that if you can combine these two or my modality and your structure and your supplements and all those put together, I think you can really make some big changes in your life.
And I think the key message here, so, you know, I have done like other advocacy type of like social media, whatever you call these things. I'm having like a moment. But, you know, I often talk about how men are more than their testosterone. Men are more than just their erections. But the erection itself is such a sensitive issue for men that becomes the point of discussion, the entry point of discussion. So it's really interesting. I know we were talking about this, and it's like, you know, your modality, what your clinic does is treat or help men or treat erectile dysfunction. But as you mentioned, as I have mentioned, erectile dysfunction is more a symptom of an underlying issue. So agreed that like treating erectile dysfunction is important for confidence, for self-esteem, for relationships. But it's really important to understand that there's typically an underlying reason as to why our patients are experiencing this. And, you know, I do have some patients who come in and I'm not always a good fit for them because I'm like, well, you know, your health is like an onion. You've like all of a sudden you know, you have developed all these symptoms, but they didn't just like arrive in your body like today. There's been an evolution that brought them to this place. And my job as a naturopathic doctor is to get to the root cause, peel the onion back, restore the natural functions in the body. My frustration can be at times that some men are looking for that really quick solution. And that's not the nature of what I do. But I don't want these guys to kind of go back off into the world and not have a solution for them that maybe, you know, might be their starting point. So their starting point might actually be, let's treat erectile dysfunction and then get, you know, their sexual body to a place where they want it to be and then start working on it. So I think that, you know, the synergy between the two of our clinics and our practices, I think is really important.
And I was going to say, don't be too hard on yourself, Dr. Yousuf, because men all want a quick fix. I think for the most part, we're quite unrealistic in terms of how we want to approach our solutions. I mean, I want everything to be fixed right away. And you know, I obviously realize that's not possible, but it doesn't change my desire to not want to have to maybe put in the effort, or, I mean, there is no easy fix to a lot of problems. And this certainly is one of them. I mean, you're talking about your temple. I mean, you're talking about I'm in the camp that I know that there's a lot of reasons for why men have sexual health conditions. And if you can get your diet under control, you can get your exercise under control, you get your sleep under control, you get all those things under control, which is no easy feat for any person, let alone a man who's maybe, we like, the way that these studies in the gender health paradox work are so interesting, because it shows such a great difference between how men and women deal with their problems and deal with their pain. And so, women go see the doctor far more often than men do. At the same time, older women, they exhibit greater decline in physical function at a quicker rate towards the end of their lives. The old line is women get sicker, men die quicker, right? So, and so it's really important for us, and I say this as a very imperfect person, to come to grips with our health and our welfare, and take care of ourselves and do what we can to improve our daily functioning.
Right, and it's I'm grateful that you're sharing that, because I think as a naturopathic doctor, my industry is most of my patients, not in my case, it's probably like a 50-50 split between men and women, but women are more women are more apt to address a symptom at the beginning of onset than men will just bury it away. So in the nature of what it is that I do, I tend to attract more female patients. And a lot of my female, and what's really interesting is I'll have a female patient come in, and then she will pull her male partner into my practice. It's hilarious. Mm-hmm. They show up with their arms crossed. Why am I here? You do witchcraft. I don't know what this is all about. And the funny thing is that a lot of men, when they come into my practice, they then somehow flip, and all of a sudden they become compliant, and they get these insane positive results. Like, it's really interesting to see these guys go from like here to here fairly quickly. And it's not, I mean, it's a total generalization, but sometimes what happens is the female partner actually gets really frustrated because she's looking at her spouse who didn't even want treatment in the first place, is all of a sudden rocking it, and she's still struggling, and it's like it becomes a bone of contention. So it's kind of funny, but it's individual, and I hope that our messaging is that is to take care of yourself. It's Movember. We men, this is a new thing that men are starting to advocate for our health, right? We're starting to say, okay, most men, like over 95% of men, will develop a prostate related issue within their life, right? Mm-hmm. Men are more likely to commit suicide. They're more likely to be successful at committing suicide. There's a lot of things that we need to unravel. And I hope that this session has been informative and kind of planting a seed that there are options out there.
Can I ask you a question, just to go back on success rates and guarantees? Because in with our modality, while it's the efficacy rates are excellent, and it's very promising, it's not perfect. So do you guys keep a success rate or a guarantee rate, not a guarantee rate, but a success rate for your patients? And at what level would you say that you operate at? And obviously, we know you're striving for 100%, but it's probably not feasible or tenable to get to that level. So what is an acceptable efficacy rate for what you're doing and how you're practicing?
So that is a great question, and I'm going to give you an answer that you probably might be a little confusing. So the nature of naturopathic medicine is that I'm treating the individual. So with focused shockwave therapy, you have a single modality, you're treating a single concern. So it's very easy to track, your success rates based on the single modality and a single intervention. In naturopathic medicine, we're treating the individual. So it's not just erectile dysfunction, it's what caused the erectile dysfunction. It's not just hypertension, it's like looking at all the different systems in the body. So when we look at an evidence-based model, what I can talk about are the specific interventions. So if I'm going to prescribe a sleep cocktail that includes high dosing of zinc and ashwagandha with the intention of boosting testosterone through the sleep, so that men then start waking up with morning erections, for example. Each of the individual components will have evidence attached to that, because I use an evidence-based model, but actually quantifying my success rates for treating erectile dysfunction, it's so multifaceted it's difficult. It's similar with
It's
pharmaceuticals.
probably impossible to really know because it requires such compliance from the patient to make those, critical lifestyle changes, right? And you have zero control over that. You can't tell them to stop smoking. You can't cure their diabetes. You can't stop them from making, poor exercise choices. It's such a multivariate analysis. I guess it's probably
But
impossible.
what I can help with is the intervention. So I, with my patients, will be like, well, for example, I mean, this is so basic, but if we're talking about cardiovascular, if you take this fiber, it can reduce your risk of a cardiovascular event up to 30%. So
Mhm.
why wouldn't you just take the fiber if it's going to reduce the risk of a cardiovascular event by up to 30%, 28% to be specific? So
People are
that's
looking.
the evidence that I work off of. So we
Yeah.
talk about, so someone comes in with like cardiovascular disease and elevated cholesterol, we have these types of discussions. We can talk about certain interventions that are going to work at dropping cholesterol, increasing circulation. There's certain botanicals where there's pretty concrete evidence.
Yeah, people are looking also for, in my experience, people are looking for more natural solutions, which is
Yeah.
why your practice and what you're doing is so vitally important right now, and what we're doing also, which is a non-invasive, no surgery, no pills required type solution
Right.
for many sexual health conditions. So people are looking for this type of solution today. They want to get away from surgeries. They want to get away from popping, potentially dangerous and high side effect pharmaceuticals. I talk to people all day, and it's amazing that they take a pill for 10 years, and uh, obviously one of the results of that is that it just stops working, like any medication. That the more you take it, the more your body becomes accustomed to it. You need higher doses for it to work, and eventually it just stops working. But the other people call me and they say, I took one of these famous pills for my ED, and my nose wouldn't stop running. It wouldn't stop running, and it's just unbelievable the side effects that these meds can have. And I think, and I don't know how it works in the naturopath business, but people are looking to avoid these types of solutions. They're looking to avoid these types of big pharma chemical solutions and avoid surgery, which would leave them with tremendous period of downtime and pain. And so I hate to call what we're doing a quick fix, but it's a natural fix. And it's I think the way of the world is going there.
Yeah, and I couldn't agree anymore. And I think it's also important. The person in your clinic who's administering the treatment is actually a doctor, a medical doctor, right? An IMG.
Right. Yes. Yeah. He's an MD, old school vascular surgeon from Ecuador. He's seen it all.
Mhm.
Couldn't ask for anybody better to discuss these types of situations with men. So we couldn't be happier to have somebody like that, doing the assessment, making sure that the patient is qualified for our type of therapy, and then providing the treatment with. I could never be a doctor. I was a Bachelor of Science, honors biology, degree. I got my degree in 2000. I could never be a doctor. But one thing I knew I always had was bedside manner, which
Yeah,
is
there you go.
my mother always told me, she's like, you got the bedside manner of a doctor. So for me, that's really important. When I go to a doctor, I look for somebody who has, quote unquote, bedside manner, but I don't mind if they're, curt and sharp, just so long as they're honest and real. And
Right.
we have that here at FocusWave Clinic. We have an awesome old school vascular surgeon, MD from Ecuador, and he's great, and he'll take good care of you.
Yeah, I had a great discussion with the two of you. I think it was last week or the week before, where we were talking about like the complexities of men's health, and that even the term, I think I was talking about this, even the term men's health irks me a little bit, that because it's such a broad, like it's basically just saying if you're a man, you're in men's health, but it doesn't really go into the intricacies. Well, Drew, thank you very much. It was great chatting with you. I'm sure we'll have tons more discussions about, the the gender paradox, how we can continue to help and advocate for men to start looking after themselves. And hopefully those who are listening will understand that there are options that are out there to help them and support them wherever they're at. So again, thank you very much. It was great chatting with you.
Thank you. I'll just do a little plug. I'll just say, if you ever have an interest in a free consultation here for Focus Shockwave Therapy, visit us at www.focuswaveclinic.com. And we are at the corner of Carling and Woodruff in Ottawa, a very convenient location. So give us a call, 613-422-9283. And we look forward to seeing if you're a candidate for this amazing therapy.
Perfect. And I believe your contact information or the name of your clinic will be in the whatever marketing Sam puts together. She's our social media person who constantly sends me emails saying you need to post on on Instagram, which may, yeah.
How do you find Instagram for your?
It's a connection. It's a good connection tool. I'm again a novice at Instagram. I'm not the right person to ask about any of that stuff.
I'm not a social media guy.
Yeah, I'm not. I'm like, I try my best, but so far it's been pictures of my cat. So
yeah.
Anyways, it's great chatting with you. Thanks for all that great information. And if anyone has any questions, feel free to contact about my practice. Feel free to contact NutriChem. Our patient coordinators, of course, are always available to answer any questions you might have. Thanks for watching and have a great day.